In Skipton today, the vaccine is coming to those who haven't been able to travel themselves to get it, and the relief is enormous.
People have expressed how grateful they are that we've come out to see them because they couldn't come to see us. Morning. Hi.
Over 12 million people in the UK have had their first dose of the vaccine already. However, there is some new evidence that some vaccines are less effective against the South African variant, in preventing mild to moderate illness at least. Today, the vaccines minister said the ability of the virus to mutate is likely to mean annual vaccinations are needed.
Chief Medical Officer and the Chief Scientific Advisor both think that the current vaccines will have an impact on certainly the UK variant and to an extent on the South African variant. I suspect we're going to be in a world where we have annual vaccination programs for COVID in the way we have annual vaccination programs for flu.
The latest research is on the effectiveness of the Oxford AstraZeneca vaccine on the South African variant of COVID. It was a small study of only 2,000 and not yet peer-reviewed. As with other vaccines, preliminary results showed it to be less effective in preventing mild to moderate illness for this mutation. However, its makers believe it is likely to be effective in preventing severe illness and death.
Maybe we won't be reducing the number of cases as much, but we still won't be seeing the deaths, the hospitalisations and the severe disease. And that's really important for healthcare systems, even if we are having mild and asymptomatic infections. To prevent people from going into hospital with COVID would have a major effect.
On the 15th of February, the government is introducing hotel quarantine for arrivals from 33 countries. Some scientists say to prevent mutations entering, that should apply to all arrivals.
A big part of this is border restrictions, which unfortunately were not put in place appropriately at the time they should have, which is one of the reasons that we now have the South African variant established within the community. So unless we have a coherent long-term strategy, unfortunately, we can't just rely on vaccines as our only strategy in this pandemic.
In 2 weeks' time, the government is due to announce its promised roadmap out of lockdown. It's hoped by then data will show the vaccine programme having an impact on new cases. But the battle against COVID is going to be a long one, with science having to keep one step ahead of the virus's ability to mutate.